Meniers disease is something characterized by vertigo and hearing loss. If someone is experiencing vertigo for about 20 minutes to 24 hours, it can most probably be the Meniers disease. Now, why do they get vertigo? It is because the endolymphatic system, that is in the cochlea, utricle, saccule, and the semicircular canals, get distended, due to which the endolymph gets increased in volume. Hence, Meniers disease is also called as the endolymphatic hydrops. Endolymph is produced by stria vascularis and it is absorbed by the endolymphatic sac. Defective absorption can lead to this disease. Here the endolymph increases in volume either because of sodium retention in the stria vascularis, which increases the volume, or by defective absorption of the endolymphatic sac. As the endolymph increases in scala media, it ruptures this resinous membrane, which leads to mixing of both endolymph and perilymph. This leads to vertigo, and as soon as the resinous membrane heals, vertigo resolves. As this process repeats, there is fluctuating hearing loss. And hearing loss is more during the episode of vertigo. As the amount of sodium gets increased, the hair cells get damaged, and we see sensorineural type of hearing loss. There are some things that are unique to a person with this disease. They hear sounds in two frequencies, which is called as diploacusis or double hearing. The patient also experiences ringing in the ears, which is known as tinnitus. In these people, normal sounds are also heard as abnormally loud, and there is an intolerance to loud sounds, and this is called as recruitment. The stapedial reflex of our body, which comes into action when our ear listens to loud sounds, gets recruited even for normal sounds, and that is how these patients are different from normal people. We all know that the stapes attaches to the oval window, but what about the oval window itself, where it lies connected to the bony labyrinth of the utricle and the saccule of the vestibule? Now, this anatomy is connected to the Tumarkin crisis, where the patient falls down while walking because of the dilation in the interior of the utricle and saccule. As this causes distortion to maculae present in the utricle and saccule, dilation in the exterior causes Tullio's phenomenon. This happens when the footplate of stapes, as we know is closer to the utricle and saccule, moves more in loud sounds and causes vertigo. When it happens because of loud sounds, we call it Tullio's phenomenon, and when it happens due to pressure changes in the ear, it is called as the Henbert sign.